Welcome back to You Heard It Here with Dr. Gary. I'm Gary, one of the clinical audiologists and part of the ownership team here with Advanced Hearing Group in Scottsdale, Arizona. This is Earwax removal vlog number 68. Right away, you're seeing a large chunk of wax come out with that curette. We're going to use the manual tools for this patient and then some irrigation, as irrigation is their primary desired method of wax removal. My favorite method is obviously the manual tools, as you see me use mostly on this channel. I do use some irrigation, of course. Here we go with that. I don't really use much in the way of microsuction. We do it a few times every now and then, but we refer out more for that if there's an issue where patients need microsuction. It's just not my favorite method of removal. That's not to say that we don't do it or I don't think it's effective. It's just not my favorite. This patient is actually the same patient that we saw in earwax removal vlog number 67. Their ears were just severely impacted. They were suffering from oral fullness, pressure in the ear, and reduced hearing. And once we get this wax out, all of that's going to go away pretty quickly. It's still coming out in some pretty large chunks. Even after the irrigation, you can see that the color of that earwax changed. We're going to hit it with a little bit more water and see what it looks like. There are different types of hearing loss. Your hearing loss can either be sensory neural, meaning that it comes from the cochlea or beyond. It can be mixed, meaning that it's a problem in the outer and middle ear as well as a problem in the cochlea or beyond. Or it could be conductive in nature. A conductive hearing loss is one like you're seeing here, where the patient has an obstruction in the outer or middle ear that can generally be resolved either via a wax removal, medication, and or possibly surgery, depending on the severity of the issue. As the patients go through these conductive type hearing losses, they notice rapid fluctuation. Some days it's better, some days it's worse, and quite frankly, once we get it taken care of, they're pretty happy. Sensory neural and mixed hearing losses are a little bit more complicated to treat, and in the case of a mixed hearing loss, it can be a combination of medication, surgery, wax removal, and amplification, hearing aids, or assistive listening devices. And then sensory neural hearing losses are generally amplification-based treatment, either through hearing aids or in cases of severe hearing loss, cochlear implants. There are some other options such as a Baha or a bone-anchored hearing aid, but for the most part, traditional hearing aids and or cochlear implants are the method for treating a hearing loss. If your hearing has not been tested in many years, please consider getting your hearing tested. We're going to get this wax out here. We're starting to see the eardrum. There's just a little bit more we want to remove. If you like these wax removal videos, please take a moment to like and subscribe. It really does help us get our content in front of more people. The more we can educate and entertain, the better off we're going to be. Take a look at that eardrum. This has been You Heard It Here with Dr. Gary. Thank you for watching. We'll see you in the next video.